Well, welcome everyone. And again, thank you for attending today's provider portal training. Please remember to put yourself on mute and not on hold. We are recording today's session. This is one of two sessions this week for providers. Both will have the same information provided. We're just offering one earlier in the day and one later in the day on Thursday. So it's your choice to attend the second one. But again, the presentations will be the same. We have a large group here today. So as we go through the presentation and the live demonstrations, if you have questions, please go ahead and put them in the chat and we will address them during the session today. My name is Teresa Kern. I'm a registered nurse and an Interqual certified instructor here at Comagine Health. And also on the call is Yvette Stratton. She is also a registered nurse and our executive director for the Alaska Medicaid contract. So today we'll review the changes that are going to be coming to the provider portal and information required to submit a request. There's going to be some new resources posted on our website prior to go live. And this presentation and what we talk about today will touch on some of the many resources that are already available to you on our website. So let's talk about what is new. So we are upgrading our provider portal. It will be effective June 5th. We have had some trainings back in April. They are posted on our website that go into a lot more depth on how to submit requests. Today, we're going to show you some live demonstrations in our training environment. Also, our staff is available to assist you. If you don't have access to the provider portal yet, we'll talk about how you can complete that registration in just a few moments. So the best way to submit a review and to communicate to us through the Comagine Health Provider Portal is entering that information in that provider portal. All interactions are automatically time-stamped and are real-time entries. This is a screenshot of our updated website. Now you would click on Programs to find the Alaska Medicaid page. And once you're on the Programs page and you find the Alaska the Department of Healthcare Services for Alaska Medicaid, there's a little link there that says Learn More. And by clicking on that, it'll direct you to the page that is specific for Alaska Medicaid. So once you're in and you can see the pages for Alaska Medicaid, on the right-hand side, you'll see are a couple of options, provider resources, provider education, patients, family, and contacts. By clicking on the contacts, you will have our contact information along with the link for the provider portal. And here's some more of those resources I was talking about. If you click on provider resources, there is a section there to register for the portal. Please download the packet, complete the packet, and once you submit it to us, we typically send you access within 1 to 2 days on how to get into the portal. So once you have that packet ready, you can go ahead and email it to myself. I'm the tkern@comagine.org, or to Justin at his email address, or you can simply fax it in to us also. As a reminder of when to submit a request, we do follow the Alaska Medicaid prior authorization list. It does contain specific procedures and services that require a prior authorization. It is on our comagine.org website. And as it gets updated, we do put a revision date. So please monitor the revision dates when you're looking at the different lists. Also, following the 3-day benchmark for inpatient requests, and then for any retrospective inpatient or outpatient service that still falls on those prior authorization lists. So here's an example of the website provider resources, and you can see the Alaska Medicaid prior authorization lists are listed there. Also, there's the imaging questionnaire that is available to providers. It's a fillable form that you can submit to the requesting provider to fill out for you if you need so. All right. So once you're on that page and you've clicked to the gain access to the provider portal, the next screen that you see will be demonstrated here. Go ahead and click on that provider login. And on your next screen is when you're going to put in your username and your password. Your current username and password should be active in the updated system on June 5th. But again, if you're having any issues, you can definitely reach out to us through our toll-free number to the intake staff, and they will be able to help assist you. Remember that the administrator should contact us to be unlocked or have their passwords reset. And then the administrator at your location will be the one to unlock and reset passwords for their staff. Okay. So once you log into the portal, it's going to ask you about agreeing to the provider user and confidentiality agreement. You do need to go ahead and click I agree if you do to get into the portal. If you click the I disagree, then it will redirect you back to the previous page and you won't be able to gain access. So now I'm going to stop sharing this for a moment. And I'm going to show you the demonstrations. So here I'm on this page where I'll have my username and my password. And there's my agreement that I have to agree to. And you'll see it looks a little different. This is our home page that when you log in, this is where what you'll see. This is our training environment, so you see lots of things. But for Alaska Medicaid, you will only see things that pertain to Alaska Medicaid providers. You have a dashboard. And again, you'll see the little spinning circle, and across the top of the screen, there's a green bar that goes across as it loads. Now this page has a lot of information, and I would like to have Yvette help me out and go through all the different areas here. Well, we might be having a little technical difficulty there. So I'm going to go ahead and talk to you about this page. As you can see, there's lots of information here. On the left upper side, you'll have some different tabs, messages, and my requests that you can click on to get more information. On the upper right side, there is the work in progress. As you can see, there's a legend that's color-coded, and currently it's empty at the moment. But if you had some things that were pending submission, meaning things that you have not submitted yet, or there may be some that are further information required, and that's cases that we have pinned back to you because we need to get some more information. And then there would be a third section there, pending decisions. In our bottom left area is requests by type. Again, you have a different little legend there. And as you can see under outpatient, we do have this color-coded bar with the number 2. And as I hover over it, it's an interactive link. When I click on it, it's going to open up and it's going to give you a list. As you see here, you have several filters. You can filter by inpatient, outpatient, or all. Again, processed has several options in the second filter. Or if you're looking for a certain date range, you can click on the date range, or you can use the calendars here to filter. So I'll go back to my dashboard. On the bottom right-hand side, you have one more interactive box, and these are decisions made. And again, it is a link to those lists, and it has its own legend there also. This page, as we can see up in the upper right-hand corner, the box to do is highlighted, and this is for an individual to manage their work. If you have a place of business that has multiple people entering things, you might want to consider using Team. And Team allows you to manage the work a little differently. Maybe if someone's out, you'll be able to manage that work and pick up for them. You can click on each of these names. And again, this is our test environment. We have still some interactive areas, the team's work in progress and the team's request by type. So you could always click on someone to see what their individual dashboard will look like. And again, clicking on any of these links with the legends for each of the sections will allow you to open up that list again. Moving across the top, we do have a memory list. And this memory list is up to 10 places that you have been. It might be a search screen. It could be individual patients. So if it gets full, you'll just have to monitor it, and there's a little X next to the different entries to remove them from your memory list. So to get started, we'll go to our menu, and you'll see here you have a couple of options: a new request, a search request. You can search a request by putting in the member's Medicaid ID number. To put in a new request, we'll go ahead and click there. You have a few places here that you can enter some information. The 2 required is your client, which is Alaska Division of Healthcare Services, and then the insurance ID. And for our training today, I have a member I will search for. And once you hit search, if they're in our system, you will have some information here. So you can verify their date of birth, their insurance ID again, and that it is in the right group name. As you see on the far right, it's add a request, and there's some actions there that you can take. By clicking on the drop-down box, you can either enter an inpatient or an outpatient. I'm going to go ahead and click outpatient. It gives me a little reminder here that something has been entered in the last 24 hours. And again, this is our training environment, so I'm going to go ahead and click OK. I can see the wheel spinning, and now it's ready for me to set up this case. Across the top in the blue area, you'll have some patient information, demographics, and such. And then to set up the case, we're just going to work our way down the page. There's nothing really new here from the current process. it is just in a different format and looks a little differently. So your episode details, we're just going to work our way from top down. The request type, kind of self-explanatory, but which is it, a prior authorization or retrospective? It already autofills some areas for us. Treatment type, you either have imaging or surgical. I'm going to go ahead and put in an imaging request. Even though treatment class doesn't have the little red asterisks, if you don't complete this, when you try to hit the submit button, it will give you an error to fix. And since the imaging is not about an inpatient, we'll go ahead and pick NA. And then your diagnosis is the next section where you'll put in the diagnosis. Just like it currently is, you can type a word, you can put in a number to get a drop-down box of some options. If you need to add a second diagnosis, you can just simply put it right in the diagnosis box. And I will show you how we can pick a different one. Your primary is still the little star. And if you need to change, you can just simply click between them. And if you've identified that there's one here that was not accurate, you can simply, over in the action, you can go ahead and delete it. I do believe in our current system, when you delete or deactivate something, it draws a line through it. In our new system, it actually removes those things under the diagnosis and the providers. So speaking of providers, the next section is providers. The little paperclip here, by clicking on it, since you are entering the request and you are listed as the requesting, it can automatically pull that for you by just clicking on that, the little paperclip. So that's the requesting. So that allows you to be able to see your case. Now we need to enter an admitting and a treating. So when I click on attach providers, you'll see it's still pretty similar. That provider, last name, or facility. I'm going to go ahead and click and hit my search. I do have an advanced search here if I need it. And you can see here some entries that have popped up. Please disregard over here where it says out of network. That field is not active at this moment. So the general hospital would be our treating. So I have it right here at the top. You'll click on that little gear and you'll see an option, single attach, multiple attach. If you only need to enter one entry, single attach will attach it and then you're completed in that section. But since we need to add several people, I'm going to go ahead and click multiple. What it does is it puts it down here in a little holding spot for me. And now I can put in my provider and hit search, and here it is, the one that I'm searching for. But what you can also do is, what we recommend is using an MPI number. And by clicking on that, you will get your correct physician. Again, I'm going to click on my little gear and click multiple attach. They're here in a little bit of a holding place. My facility would be my treating, and my provider will be my admitting, and then I can click attach. I got an error. Let's see what.
Your individual should be your treating, Teresa.
Oh, so sorry.
I finally got off mute.
Okay, so let's see, where are we at here? We have, this is my admitting. And it's going to give me an error. So great opportunity to show you. I'm just going to go ahead and remove that one and try again. So I'll go ahead and put in my facility. And here is that.
So your
There we go.
individual, the middle one could be your treating, and facility vendors, you're admitting.
Okay. So I can go ahead and click those.
And then you could check your provider role. So your selected provider list, if you do multiple attach, your selected provider list displays below, and then you could just verify that you have the correct roles. So you should have, the top one should be your treating and the bottom one should be your admitting.
For the facility?
Oh, wait, let's see, you've got, oh, right there it tells you. So nope, I reversed you, sorry. Your provider, you had it correct. And then you can select attach.
Nope. Okay. I like to just kind of look again. So I have our requesting, and now we're going to attach. The facility that I'm going to use is General Hospital, and I will search for them, and I want them as my admitting facility. And then I need to add my physician. Again, you can use a name, or better yet, use their MPI number. And this is where they're going to be my admitting and my treating, correct? I believe so. Oh, my stars. Yvette,
you have them reversed.
did I reverse them again?
Well, you know what? Right there's your tester. Just change your provider role there and then attach it. That is your individual treating, yes. Now you
Okay.
can go back and attach your admitting.
It's not this hard, folks. I'm the one having the difficulties here today.
It's difficult when it's a testing environment too, and you have a test hospital in there. The recommendation is to use your NPIN or provider ID number. That'll really help you narrow your search when you're submitting a PA request.
Perfect. Thank you. Now I got it straight. So we have our requesting that allows you to get into the case. It has your physician or your provider as the treating, and then your facility as the admitting. If you ever needed to adjust them, when you're setting up the case, you have an action icon on the far right that you can remove them and then reattach. Our next section will talk about service that you need to enter for the request. And again, we just kind of work through all of the main ones. You do need to select your code type and then your service code. Again, it'll pop up right below there. And then my start date, I will put for today, and it's going to give an end date of 1 day later. Remember for imaging providers that you can submit this for up to 4 months. If you know that someone's going to need repeat imaging, we encourage you to shorten that time frame so that there's not any claims issues. We are requesting 1, and then I'll click my Add button. It'll kind of go through its processing here for a moment. And then typically it brings you right back up to the top of the page. I'm just going to go ahead and scroll back down a little bit to this section. You can see here that my service requested is right here. If you need to add a second imaging request, as we are doing here in this example, you would just repeat this section as many times as you needed for the codes and hit add each time. If you need to make adjustments to this line, remember the gear is your friend for making those edits or to remove it. By selecting this code and hitting the add button, it automatically has created the assessments that you need to complete. You'll see that you have some filters over here, new, in progress, and completed. So again, we're just going to click on the gear, and it's going to give you a couple options. And the best one for us is to start that request. Please notice that the assessments look different, but all of the information is exactly the same as it is today if you were to put in a request. I'm going to go ahead and answer my questions. It's not work related. Was this an injury? No. I'm just going to click away here for example, I'm going to pick my other because my code is 70552. And it'll tell me here that that the imaging assessment B has been triggered. Do you want to start it now? And the easiest thing to do is to just say, okay. It's going to hop over to that other assessment for you. I'm going to go ahead and answer my questions, complete my affirmations and acknowledgments, and then I'm going to click the Save button, and then I'll click Complete. And then it takes you right back where you had stepped away from this assessment. We'll go ahead and click a couple of sections so that it will properly process for us. Granted, the information I'm entering here is not consistent with my request, but just so that you know that I'm just completing this for training purposes here. When I get down, I can say I don't have any others, and it'll remind me here, click Save. If I missed anything, it'll give me a warning box, and then I can hit my Complete. And that's where that box is. It's telling me. Go ahead and click that. I'll go ahead and click my Save again in my Complete. And it has been completed. As you notice here now under Add Assessments, it looks kind of blank. But if I go to my filters and I click on Completed, you'll see where they are. Again, clicking on the gear will give you some options of what you can do through that line. Okay. Adding documents is very similar to what you do now. You'll click Add a Document, you'll give it a title, and you can browse your system and then click Add. Okay. I'll say okay. Now, if you're one that maybe you don't attach documents here, you put information here, or you need to communicate something to us about this member, go ahead and just put that information right here. Alrighty, so we've completed all of the steps. My options, I have a few options here at the bottom. I can save it as a draft. Maybe I am waiting on a document, and then it will be on your dashboard in the pending submission still. If unfortunately you realize that this is entered for the wrong member, go ahead and hit delete. Or you can say the big green button, I'm ready to submit. And that's what I'm going to choose. It gives a moment while it processes the information. Okay, now this next screen, don't click away from it too quickly because it has a lot of valuable information for you. It reminds you of the episode type. Our system has two sets of numbers, an episode number or your reference number. That reference number is what you'll use for your claim, and it'll let you know here what status it's in. So this is letting you know that this request has been approved. So this is where you can do a screenshot or you can write down that information for your case. Okay, before I move over to an inpatient request, I'm going to check back and see what kind of questions we might have before we move away here from outpatient.
Lisa, I've been answering some of the questions.
Okay.
The
Perfect.
question that I haven't answered is Lauren Edwards asked if we could talk about the acronyms used in document type. And I'm not sure what acronyms.
Okay, yeah, I'm not sure either.
So I went to the slide deck with the documents, document type. It's not
Okay.
a mandatory field. So I think for document title, you could just, if you're submitting clinicals and H&P or labs, you can write the document title of what you're submitting. You don't have to use the document type in their dropdown. It doesn't have a red asterisk and it's not mandatory. What does have a red asterisk is document title and select document. And then you can add it and then save it. That's slide deck 37, Teresa, if you're interested in the slide number.
Okay. We can look at that because on the inpatient request that I'll demonstrate next, it's very similar. It's the same. So we
Yeah.
can look at that again when we get there. But yes, just like Yvette was adding, yes, please kind of label it is most helpful. Admission H&P or clinical X-ray, things like that. As we're looking through completing the reviews, it is really helpful. Okay. Okay, so I'm going to go ahead and work through submitting an inpatient request now. Again, I just go to my menu and I put in a new request. I'll put in my client and my member's ID number and hit search. Here's our member again. And again, on the far right, we have an action, inpatient or outpatient. So let's look at the inpatient because it does look just a little bit different, but it acts pretty similar. Again, it's top to bottom. The request type, we'll put in pre-admission. It'll automatically do non-urgent. If you have anything more urgent, please contact us. And the asterisk treatment type, we'll do medical. And again, this treatment class doesn't have an asterisk, but you will get a hard stop if you don't. So we'll say they're currently admitted because they've met their 3-day benchmark. My diagnosis. Let's see. I just have a code I'm just throwing in there for right now. Again, diagnosis works the very same. If you need to add a second one, you just put in the code. If you need to move the primary, you just simply click on the star that's not highlighted. Since there's only one entry here, your actions, there's nothing to do. You can't remove it because you have to have at least one. So before you can remove this one, you do need to enter the correct one that you would like. Okay, providers. Let's see if I do this a little better. Going ahead and still clicking that paperclip will enter the requesting provider because you're logged in as the requester. Clicking attach. Entering my facility. I can hit search or I can do my NPI number. So they are the admitting. Oh, but don't mess this one up again. By clicking on multiple attach, it puts it down here in the holding pattern. I can go ahead and put in my provider is my treating. I'm going to click multiple because it'll pop down here in my holding pattern. And I do believe there we go. Okay. Again, I'll just move down the page. Now for an inpatient, you have your stay request and you have service request if there's any service codes that you need to add. Your stay request will be completing the admission date. We'll put Saturday, their actual, and how many days you're requesting. Typically, you can request 5. If you need to ask for more than 5, for example, in this for a neonate, go ahead and enter 5, and then I'll show you in the notes to go ahead and put in what you do need to request. So here I'm going to go ahead and hit add. And again, it kind of brings you back to the top of the page. It's just a quick scroll down. You can only add one service line or one stay line. So if you need to make any edits, the gear is your friend. If you needed to add a service request, you would click on Add Services. And it's automatically populated here for an assessment for you to complete. Just like on outpatient, you have a couple of filters, new, in progress, and completed. By clicking on that gear, I'm going to start my assessment. This assessment is exactly the same as if you were to enter one today. You'll go through and answer your questions, answering, whatever's most appropriate, and then submitting clinical to support that. I'm going to go ahead and say none of these are applicable, and a confirmation, and completing my affirmations and acknowledgments. And then I will click my save and my complete. Again, it prompts you back to the top of the page. I'm going to scroll down. My assessment is gone because it's here now under completed. All right, here is your adding documents, and this is where you can label it. The document type is not necessary. The document description is not necessary. And then I would just hit browse, search your own system, and then click add. I hope that answers your question from before. I'm going to go ahead and close out of there. So for the web, all your note types will be web so that we can see them. And then here can be a variety of information. Something about the case, maybe they've just transferred, is extremely helpful to know because those are submitted within 1 day as opposed to following the 3-day benchmark or the hot list. If you need to ask for more than 5 initial days, maybe it's a neonate that's born super early. And of course, we process them a little differently. Maybe it's a surgical plan and you want to tell us what that surgical plan is or add clinical. You would add all of that information here. And then when you're ready, it doesn't save until you hit either save as a draft or submit. So you can attach documents from the facilities or that maybe you've been, gathered for a member, or you can here still under this section enter notes. You can enter clinical information. Remember that entering clinical information here still needs patient identifiers and dates. That will help us to confirm that information is accurate for this member. So since I'm ready to go ahead and submit this one, I'll hit my submit button. You'll get a little bar at the top. It says it's saving it as a draft, and then it'll give a second message, I do believe, that says saving the request. You'll notice that you'll have a green spinning a circle in the middle of your screen, and towards the top, you have a green bar as it processes. And there it says, request submitted successfully. This one, it's pending right now because it needs to be reviewed. So again, you can click on your abstract to see what you submitted. And this is also a printable item for you. All righty. Is there any questions that we need to address, Yvette?
Kim just sent one that said, I'm new to UR, so I just want to make sure I can attach the actual H&P progress PT notes, etc., to the site to support a continued inpatient stay? And I was going to answer it right now.
Perfect.
You can,
Yes.
Teresa.
Yes, you can enter those notes. Remember that we are only supposed to receive the minimum necessary to conduct the review. We do not need the whole chart. We do not want the whole chart. There is detailed information back in our April trainings about that. We just need the pertinent information for that request. For a continued stay, we would be looking, you would receive a note that says when the next review date is, and we would need the information for that. And if you're new to UR, either check in with your manager or you're welcome to contact us here at Comagine Health, and we'd be happy to help walk someone newer to the process through with some individualized trainings.
Thanks, Teresa. And Lauren said, you said transfers. You mean transfer between different in-house units or transfer to another facility hospital?
It's facility transfers. If they're going from one area in the hospital, say ICU to the medical floor, we do not need to. That's good information when you submit the request, letting us know that they've either stepped down or stepped up is always helpful. But we providers, inpatient providers, submit the initial request following the 3-day benchmark or the hot list. Or if it's a transfer from another facility, then those are done on day 1.
And then Amy asked, is Medicaid requiring the referring providers to submit imaging, the prior authorizations for imaging? We have never done that in the past.
I'm looking at that note here. Is Medicaid requiring the referring providers to submit imaging for? We've never done that in the past. So typically, most places, when they need to request an imaging, they've contacted a local imaging provider, either at a facility or a freestanding imaging center. They typically gather the information and submit on that member's behalf. We do have a few providers in the state that have some agreements that they submit the request for that imaging place. So I would just follow whatever your current practice is.
Then I have another question from Robin. For radiology requests that have already been approved, are we able to downcode ourselves, or will that need to be called in, or will need to send in a message? Also, can you show how to look up a pending reference number? I think you should go to your dashboard, Teresa, yes, and then refresh your dashboard.
Which is right up here in your upper corner. And as you can see, I did a few things today, so now
you've got
our system is changing. So pending decision is black. So we have one pending. So if you click on that, you would see that case that we just that was entered. Clicking on the gear, you can open it. And oftentimes, when you open it, it's most of the time it's in a read-only mode. You're not able to really make any changes once you've hit submit. So if the notes section is available and you can add a note like here, then go ahead, like any code changes that you need to make, and I'm assuming that's what you mean by down code. If I'm not following you correctly, please let me know. But this is where you can put in notes, you can, make changes, things like that. You typically cannot make the changes in the case, but by leaving us a note, we can let you know what we can change for you.
If you went back to the IP link, the breadcrumb, you could see you can add additional notes, you can add diagnoses, you can add documents. And then Teresa, can you go to the menu, and the menu drop down? well, you might have to exit the case. So,
Okay.
yeah, you could either exit right there. Yeah. So go to your menu.
My menu.
Yeah, do search request. And then you need your client
And my
insurance ID.
and I can search. And then this will be a list of those cases and their statuses here where you can
Yeah.
look up a member. And remember, the gear is your friend. If you have either kind of a view option or if there's any actions that you can take, once you open the case, you'll be able to see what you can make amendment changes to.
And you could show the reference ID is right there too, a few columns down. Yeah, reference IDs are here.
Yep, right here.
Um,
Oop.
if you wanted to, yeah, and then it tells you the status on the far right side. So if you have something pending decision, it's already been sent to us for processing. It'll show what's been processed. And if you have something in draft on your dashboard and you actually searching for an individual, it would have pending submission there. Also, if you look at the top, you've got the mandated fields are the client field and insurance ID. But if you had a specific reference ID and you went to the right side and you also plugged that in, it would help you. And I think you could put, 883721112 there, Teresa, and then click search, and then it'll narrow the search to that individual reference ID.
What I'm finding with the provider dashboard is you don't have very many dead ends. You have lots of options in these different areas, and with the filters, I'm excited for you guys to be able to manage your work. Some of these features you've asked me for years if this is possible, so I'm so excited that they are possible for you now. All right, let's see if there's any other questions here. So typically, I see one here. Can you add documents after you submit? I would encourage you to click on it to see if there's the add button. If there's not an add button, if you leave a note for the intake staff, then they can adjust the case so that you can add the notes. Typically, once it's been submitted to the clinical staff or to our physicians for review, we ask that you don't add more information. Let there be a decision because it's going to change the process at that moment and actually cause a delay if you add more information until there's a decision.
And Teresa, could you go back to the dashboard just to show the legend again?
Sure.
And see, work in progress has pending submission, and those would be those cases that you started but didn't finish. So they're in draft form and they have not been submitted through the portal to Comagine Health. Further information required, those would, that if there were things sent back to you requesting additional information, there would be a link there and you could select the link and it would open that page displaying those episodes that require additional information. And then from there, you could go in, open the episode and see, read the notes, see what's missing, add additional information, and then send it back through the portal.
Okay. When you're working on your dashboard, remember that you have a little refresh up here and it'll tell you how long ago it was since it last refreshed. And I encourage you that each time you come to this page, either under the to-do as an individual or as a team, hit that refresh because this is real time entries. So by clicking on that refresh, you will get the most up-to-date information.
And Teresa, click to do again, please, for the individual work that you're submitting. There's my requests, and you on the top right-hand side, my request is also a page of episodes that displays and shows what you've requested. And there's also those filters at the top, so you can narrow your search for IPOP, further information required, pending decisions, even processed. And even the status is displayed in this episode page. So you know what's been processed and pending a decision if you want to look at everything. So you can narrow your search in the drop downs, or if you want to see everything on a page, you can also select all and just see everything that's been submitted.
Okay. All right. A question. What about adding a discharge note prior to decision? If you had requested X number of days and they've discharged, that would be some good information to submit to us in a quick note that they discharged on a particular day, less than what you had originally requested. So that's a good question. Thank you. Can you receive an email that if you need more information, if you're requesting more info or have any questions, meaning from Comagine Health? No, at this time, there's not a function to send an email based off of your login entry. We just encourage you to check the provider portal here. Again, that dashboard, clicking on, sorry, my dashboard doesn't want to open.
Oh, sometimes you just got to give it a minute.
Okay, yes, I get impatient, I'm sorry. So here's that memory list. So here are your cases. You can also click the little X to remove them, or you can just say close all. We'll give it a moment here.
It is the
Oh,
test environment, so it might be just taking a few minutes if you want to answer some more questions, Teresa.
sure, let's see here. Will processing time change for imaging requests, specifically MRIs? We do have up to 15 days to complete those requests once we have all the information. So we encourage you to submit the information, completing the imaging assessment as appropriately as possible. And if it's something that you're not as comfortable completing that assessment, that's why we have that imaging assessment that's a fillable form on our website. You can download it and you can send it to your provider to say, please complete this for me. I have someone that says they don't typically log into the system every day. Then I would encourage you, when you are able to log in, make sure you hit that refresh button and you'll get the most up-to-date information when you can log in. Question, if we had a note to an existing PA approved or pending, does note redrop for review to UMRN reviewer? Example, if we have to change the CPT codes or change admission class or change data service. What will happen is once you put in that note, it'll go to our intake staff, and then they will help to make those corrections as they can. And then a question, did I hear that we will no longer be accessing Comagine through OHP?
One health port.
Can you answer that one then, Yvette?
I didn't think we did, but I'm going to double check now that Robin's asking that question. Robin, let me double check that. I'll try to get an answer before you're done here, Teresa.
Okay. Okay, just looking through. On Comagine's site right now, it states the provider portal training and presentations completed in April 2023 are available at comagine.org, but I can't find the presentation to use for future reference. Is there a tip sheet or a work guide, a job aid on this new site?
You want me to answer that, or?
Yeah, so
Okay.
I actually have here our website. When you log into comagine.org, this is what you'll see. It looks a little different, but it's really, everything is still there. We just, cleaned it up and made it look a little better. So click on programs. It's going to take you to a page now instead of the drop down box. And this is where you can scroll down to the different services that we help with. So here for Alaska Medicaid, it kind of talks a little bit about it. You click on this Learn More, and that's how you get redirected to this page. It used to be this information was on the left side, now it's on the right side. So by clicking on Provider Education, you'll see this is our under Events. This is where you can register either for today's session or the one on Thursday. The trainings that I was talking about are right here. The spring provider training that were completed in April. This is the slide deck, and then this is the recording. It's a little less than an hour, so but it'll give you a lot of information that you can download either one there. After we're done today session and Thursdays, then this will be updated to have that similar information where it'll have the different slide decks and then our recording. Provider resources is another great tool. This is where you have your prior authorization list, that imaging questionnaire, if you need to get registered. And here we will also be putting some additional resources. I do believe it's going here. We have it's called a quick start guide. For an outpatient request with, it's a step-by-step process along with an inpatient quick start guide. Both are a step-by-step guide with some screenshots of how to enter a case like we've gone through today. And those will be present here soon. Not to get the two different systems confused, they will probably be added just prior to go live, which again is June 5th. When you log into the portal over the next week or so, please pay attention to those notes when you log in. Our current system on June 2nd will be turned off, and the update will be available the morning of June 6th. And as we have more exact times and the time zone that those things are going to happen, we will put that information up there for you. But over that weekend, you will not be able to enter any requests. Are you seeing any other questions?
Yes, Jennifer asked a question. When it comes to submission for a date of service that is within 30 days, it takes 15 days to get a decision, but each request for additional information resets the decision timer. Is there an option to submit farther than 30 days ahead for a date of service by not putting a specified date? How long are authorizations valid for?
Okay, it's good questions. So typically we receive requests for services in the next 30 days. And yes, by requesting some additional or clarifying information, it often does reset that that process a little bit. And you do have to put in a date to start with. I'm thinking this is talking about maybe like surgeries. If it's a surgery, then they're valid for up to 4 months. The authorization will only list one date of service because that's how it needs to be submitted to Conduit. But it can be adjusted, and that would be a simple phone call to us or entering a note if you can.
While you're looking at the questions, Teresa, I'm just going to point out that additional provider resources will be added here. The provider portal registration packet has been updated. There's also going to be a provider portal user guide that will have information on how to navigate the dashboard, as well as manage the work and understand what those links are and what the legend is on the dashboard. There's also going to be a provider portal administrator guide, and that administrator guide, because the administrator for each facility can control who they add as a user, they can control passwords and reset passwords, activate, deactivate users. So there's a administrator guide that will be on the website as well as how to submit an IP request and how to submit an OP request. Step-by-step guides will be included in the provider portal user guide. And so we'll have an announcement on our website. We didn't want to put them on the website too soon before upgrade on June 5th because we didn't want to create confusion when somebody goes on there to pull information, but we'll clearly document the updated information and make it clear that this is information and new resources for Jiva upgrade. And the slide deck, we have I know Teresa did a live demo today, but we also have a step-by-step in our slide deck. Since we're in the test environment, we created a slide deck just in case the test environment wasn't functioning appropriately. So the slide deck will also be posted on the website, and it'll be dated for May 2023 upgrade training.
There's a few comments in the chat that says that the communication today's been a little choppy and that several people have said they haven't been able to hear everything, that it's kind of gone in and out, and I apologize for that. I'm hoping that the recording will not have that on it, but we do have a training again on Thursday. It's going to be the same presentation. Someone said, when does this go into effect? The upgrade will be June 5th. It'll go live. But on June 2nd, Friday, June 2nd, there will be a time that the system will be shut down so that those changes can be ready for Monday morning. Question, for the downtime, are we to submit all as current or retros for the patients already discharged during the downtime? So if you have an inpatient request and they've discharged over the weekend, then we would just encourage you to, the cases should carry over into the new system. You should be able to just on Monday enter that updated information.
I also want to point out, if you have any open requests, so things you've started but haven't finished on Friday, June 2nd, and you have not submitted them through the portal, those will not transfer over because they're open status. So nothing's been done to those and they haven't been submitted to Comagine Health through the portal. So those would have to be resubmitted on June 5th in the upgraded system. Also, the assessments haven't changed and the overall process for requesting prior authorizations hasn't changed. The look of the upgraded system is really what's changed. And it's just scrolling down the page as opposed to having tabs that you had to click on. And the new feature would be the dashboard, which, you know, hopefully you'll find beneficial in managing your work and being able to at a glance click on links and open episode pages if you really want to narrow your search of what you're looking for, what's pending submission, all your drafts, further information required, so you know we're asking for something, or you know knowing what really is pending a decision and what's been already processed.
Lots of great questions today. Please feel free to reach out to us through our 800 numbers or email. And we look forward to the new upgrades with everyone. We will have an additional training on Thursday if you would like to attend, but again, it's going to be the same information. Otherwise, we'll go ahead today and close out this training session and say thank you so very much for all the wonderful questions and your attention to this training. Thank you. Have a great day, everyone. Bye-bye.
The website